Panic attacks can be debilitating experiences, often mistaken for serious health issues such as heart attacks. It is crucial to comprehend the nature of panic attacks, identify their causes, and implement effective coping strategies. This video explores the insights shared by mental health professionals in Ohio on panic attacks, shedding light on their characteristics, triggers, and recommended coping mechanisms. If you're looking for an inspired read that goes beyond the pages, the Anti-Anxiety Formula is the ideal choice. Immerse yourself in this transformative guide and discover paths to a calmer mind and a more meaningful life. People experiencing panic attacks may initially mistake them for heart attacks, especially when encountering symptoms like chest pain or tingling in the hands, particularly during the first episode. Clinical psychiatrist Brittany Pawlowski notes that after the initial panic attack, individuals often recognize distinct features such as shortness of breath, nausea, and tingling sensations. Unfortunately, these alarming symptoms can lead people to seek emergency medical attention, fearing a cardiac event. Panic attacks are described as brief but intense surges of anxiety that trigger unpleasant physical sensations, including shortness of breath, nausea, physical trembling, abdominal discomfort, fainting, and dry mouth. Pawlowski emphasizes that panic attacks typically last around 10 minutes, distinguishing them from longer and less intense anxiety attacks. Pawlowski uses the metaphor of a kettle on a stove to illustrate panic attacks, likening the pressure buildup to the continuous heating of water until it reaches a boiling point. The whistle blowing from the top of the kettle represents the panic attack. This analogy underscores that the triggering event is the release of accumulated nervous system pressure rather than a specific external cause. Underlying anxiety as a precursor. Pediatric mental health specialist Carrie Baker underscores that the majority of panic attacks stem from underlying anxiety. She asserts that experiencing panic attacks is highly unlikely without a pre-existing anxiety condition, emphasizing the interconnectedness between anxiety and panic episodes. Various stressful situations, both past and present, can contribute to the occurrence of panic attacks. Factors such as childhood trauma, divorce, or the loss of a loved one are identified as contributors to anxiety, which may escalate into a panic attack. Pawlowski points out that there is no conclusive evidence pinpointing a single cause for panic attacks, but genetics, substance abuse, and certain medications are recognized as potential contributors. Clinical psychiatrist Dr. Rajiv Parinja at Mercy Health identifies social situations as potential triggers for panic attacks. Job interviews, unfamiliar crowded places, and public speaking can provoke anxiety, potentially leading to a panic attack. Parinja also emphasizes the role of the fear of having a panic attack, which can become a self-fulfilling prophecy, triggering subsequent episodes and avoidance behaviors. Dr. Peter Mezzo, an associate professor at the University of Toledo, introduces the concept of panic disorder, wherein panic attacks seem to occur without a clear external stressor. This disorder is characterized by panic attacks arising seemingly out of the blue, driven by internal sensations and their perceived significance. Pawlowski acknowledges that there is no foolproof method to halt a panic attack once initiated. However, maintaining composure and focusing on controlled breathing are recommended strategies. Attempting to prevent an attack can exacerbate anxiety, so accepting and understanding the experience becomes crucial. Engaging in therapy is highlighted as a valuable resource for managing panic attacks. Baker emphasizes the importance of implementing coping strategies learned in therapy, including stepping back, deep breathing, using a cold compress, and employing cognitive skills to provide reassurance during an attack. Understanding and coping with panic attacks involve recognizing their nature, addressing underlying causes, and seeking professional support. By implementing effective coping strategies and accepting the interconnectedness of anxiety and panic, individuals can regain control and minimize the impact of panic attacks on their daily lives. And for those of you who have come this far, subscribe to the channel to learn more about mental health and personal development with me. See you in the next video.